Kelly from Motion Rehab, and we're back. And today we're going to be talking about a very broad question, but what does a physical therapist do? I think there's a lot of different ideas out there of who is a physical therapist, what we do, in what setting. Whether you're a student looking into physical therapy school, whether you're a college student, high school student, and just trying to get more information, this video is for you. Or maybe you're a patient and you're just curious of how physical therapy could potentially help you. So today we're going to just kind of go over, what a physical therapist does and kind of where you might find a physical therapist. All right, let's get started. First question I'm going to kind of answer is, what does a physical therapist actually do? So according to the APTA, which is the National Organization for Physical Therapy, they categorize us as movement experts who improve quality of life through prescribed exercise, hands-on care, and patient education. That's straight off the website. An easy Google search for you all. So what does that mean? What do those words mean? To me, that kind of description means that we're fitness-forward clinicians. We're working with you using a variety of techniques, whether that's hands-on manual therapy or specific exercises geared to your hip problem or your back pain, or if you just had a knee replacement, those exercises that are prescribed specifically for you. And the third component that was described in that definition is patient education. So that means we're educating you obviously on said exercises and maybe about your anatomy or maybe about kind of your physiology and what's going on within your body. But we're also providing you with education of the importance of what we're doing. So in regards to that definition, there's three aspects. It's threefold. We're using exercise prescription, hands-on manual therapy techniques, and patient education to provide you with the best plan of care possible. So in regards to what we do, this can be anything from a physical therapist teaching you how to walk again, whether it's after a stroke or after your hip replacement, or climbs the stairs with confidence, or to even relieving shoulder pain of a high school pitcher to improve their overall curveball. The idea is with the physical therapy, we have a wide scope of practice and we can treat a variety of patients. Overall, physical therapists are here to improve your quality of life and hopefully transform your mindset in some which way. Also here to, give you the reins, educate you of how to take care of yourself for years down the road. So some examples where a physical therapist is that person that you could potentially go to is, for example, recent back pain after moving all those boxes all weekend. Pain with squatting, you're a CrossFit athlete and you're having some knee pain. Trying to PR your deadlift, this is more athletic kind of centered, those examples, but also we can go into hip pain when running. And then when we go into some of our older adults, you might want to see a physical therapist if you are feeling a little off balance, or if you're getting a little bit of dizziness when you're rolling over in bed, or say you just want to have more confidence carrying a laundry basket up and down the stairs because you feel like you're just a little bit off balance, or maybe you just feel a little bit weak and you don't trust your legs. Those are all great examples, and there's many more examples of when you should potentially see a physical therapist. Like I've already mentioned, physical therapists can treat a variety of patients at a variety of ages. Because basically there is a physical therapist, there is a fitness-forward clinician out there for everyone. It just depends on who you're looking for and what your goals are. All right, number 2. So what settings, where can you find a physical therapist? And easy answer, really pretty much anywhere. So some of the more common places you might find a physical therapist, maybe you've come across them, is the hospital, whether it's just on the hospital floors, acute care setting, or even if maybe you've seen a physical therapist in inpatient rehab, meaning like after a spinal cord injury or a stroke or an amputation, things like that. They're in skilled nursing facilities, so maybe you saw or you worked with, or maybe you saw your grandma work with a physical therapist when she was in the nursing home to get her stronger to get back home. Home health, physical therapy. That's pretty common, where the therapists go into your home. Sometimes this is often after, a hospital stay, and you're just a little bit deconditioned, maybe a little off balance. The home health PT will come in and work with you there. And then one that we're greatly known for is just the outpatient clinic. Those are oftentimes more orthopedic minded, but there also are other specialists within the outpatient clinic. This can be anywhere from women's and men's health to neuro to vestibular to concussion to sport specific to spine specific. So outpatient clinics, it's becoming very broad to very focused nowadays, because oftentimes physical therapists will go to do a residency or a fellowship to really get more specific and narrow down who they want to work with. Other examples include so you can work for sport, or you'll find a physical therapist with sports teams, NBA, college, whomever, or even school-based. So there's physical therapists out there that work with kids, pediatrics, within, a specific school system. And in the non-traditional, and there's also non-clinical jobs out there that are becoming more and more common, where physical therapists are becoming more involved with insurance companies, such as case managers, or even sales, like equipment sales. So there are non-clinical jobs out there as well for physical therapists. And, that can also go hand in hand with the academic world. There's, we need physical therapists out there to teach the future of physical therapy. Third question, how does one become a physical therapist? So this has changed over the last, couple decades now. Before it was like a certificate program. It was just a college or like a 4-year degree, and then went to master's, and now across the board, pretty much all schools now are doctorate programs. So you, at the end of finishing your grad school, you have a doctorate of physical therapy at the end of the day. So ultimately, what does this mean? You will be in school for at least 6 years after high school. Sometimes there's programs out there that's like a 3+3 program, where you do 3 years of undergrad and then 3 years of grad school. Personally, I did the kind of more traditional route. I had 4-year undergrad at one university, and then I went to another university for the 3 years of grad school. So, and what I've kind of picked up recently is, in the last probably 3-4 years, I think, more schools are developing hybrid programs. So where you might do a majority of your classwork online, and then you might have to go to said university or college for a couple weeks every couple of months to get more of the hands-on techniques or practicals, things like that. Which, in both, there's good and bad reasons for that. I know a lot of those hybrid programs will save you some money as well. It just, you have to figure out kind of what you want out of said program. Your coursework in general over those long 6-7 years will incorporate a lot of class, a lot of presentations, hands-on techniques, practicals, and as well as clinicals. I touched on another video the importance of clinicals. So that's an important aspect of your PT school, is the clinicals in general, because that's where you're going to learn, honestly, the chunk of what you're going to use in the future. But every program is different. Like I've already mentioned, some focus more on online learning, while others, want you in the classroom all the time. Long road, but becoming a physical therapist allows you to be very, very flexible and versatile at the end of your schooling. So hopefully this helps you today to understand what a physical therapist does, whether you're a prospective student or a patient just looking for, maybe why I would want to see a physical therapist. So hopefully I helped answer any questions you might have. If you have any, just, drop a question down below and I can try to answer it. But if you're a student, just take your time, okay? There's no rush. Take some time to figure out if physical therapy would be a good fit for you. Go shadow a variety of settings. Most clinics, hospital settings, whatever, they will allow, even high school students or college students come in and shadow for, once a week or something. Just get an idea of what it is before you actually spend all that time, that commitment, and money, obviously. And also, if you're a PT right now, know that you're not stuck in this setting. You're not stuck in this job. There is always time for you to change your mind. Maybe physical therapy was a good fit for you at this hospital setting 10 years ago, but now your body's wearing down. It's a little too, it's stressful. Look at a new setting. It's okay. Everyone, you might be worried about starting from the beginning. That's okay. Everyone does it. And, that just shows growth in who you are. And it's always good to try something new and to push yourself. And maybe you're getting out of physical therapy completely, or maybe you're going to non-clinical. That's okay too. You just need to figure out, obviously it's a job, and obviously we all need money to kind of live, but you need to also factor in what makes you happy at the end of the day. Because if you're unhappy, you're not going to put 100% into your job for, let's say, patient care. So, don't do it. Figure out what would make you happier, and kind of go from there. Life is short, and you don't want to regret anything, let's say, in 5, 10, 15 years. So do what makes you happy. All right. So you got this, and I believe in you. So thank you for stopping by. I really appreciate it, as always. And just remember to get out there today and figure out what makes you happy, and just be true to you. And we'll see you next time. All right. Thanks, guys.